Hey, it's your girl, Dr. J, with my mental health and wellness tip. From my perspective, we are in April, so we know what time it is. It is Autism Awareness Month, so that we might shed light and be informed about ASD, Autism Spectrum Disorder, which is not a mental health disorder. It is a neurodevelopmental disorder. So let's keep that in mind. But let me take a moment just to to congratulate every parent that has a child that's on the spectrum, and you have used your platform to inform people, to wipe out and erase the ignorance about autism, making people aware. I want you to know that it is people like you who are helping me, because I often make reference to your platform and send somebody there so that they can gain insight on how you deal with your children or your child, even if it's your adult, those that might be low functioning or those that might be high functioning. But I want to commend you for what you're doing. And so I just want to take just a little bit of time to share and spread some awareness of autism, and especially with my young parents who are ignorant to it. Yep, I said that, because rather than having your child tested, and there's just so many places. If you're in the Atlanta area, there is Leslie Autism Center, or you can Google it. It is better for you to be in the know so that you can better help your child function from day to day and have your child equipped with the needs that your child will need with living with autism every day. So please keep that in mind. And so I just want to talk a little bit about the different spectrums. And I want to talk about that because I had someone to say that they think that their child might be on the spectrum, but they were not familiar with the different spectrum. And so there is spectrum 3. And if your child is on spectrum 3, that's severe deficit. They might be verbal, non-verbal, that is, or they could be, they have the social communication skills or impairment is very severe. And so that's level 3. And so they require very substantial support. Somebody could be on what they call level 2, which requires substantial support, but not very substantial support. And this is marked as deficient in verbal and nonverbal, and there is limitations in the social communication. And then there's level 1 that requires support, but without support in place, they may experience some deficient in social communications in other areas, but for the most part, they're high functioning from day to day, and they can do so many things on their own, and they comprehend. So just keep in mind, when we're talking about ASD, Autism Spectrum Disorder, we're talking about persons falling on the spectrum. They might be on level 3, 2, or 1, but there is so much help out there. I recall I have a client who has a son who was very interested in what was going on with her son at an early age. She got him tested. She found supportive programs in a community, places like Hope Bridge. And Hope Bridge is an autism center that's from state to state, where you can take your child and get some what we call AB, behavioral therapy for them, or occupational, or speech. One of the other things is aquatic, water. Those are just things that are supportive and helpful to persons who are on the spectrum. So again, don't be ignorant. Get in the know. If you have a child that you might think that's on the spectrum, there's some things that you can pay attention to. Walking on the tippy toes, having extreme sensitivity or textures to food, or certain sounds. I had a young lady with the son who did not like the way his bowel movement hit the water, the sound, and that was a trigger. And so just getting him used to things, or going online to Amazon and finding the potty training chair that will silence the sound. There's just so many things that you can do to help children who are on the spectrum. But more than anything, please be aware, spread awareness about autism so that people can be in the know. And as I stated earlier, there are parents on social media and TikTok doing phenomenal jobs as far as bringing awareness and bringing you into the life of their child and showing you some of the things that children or people on the spectrum go through or deal with and how they are functioning. So again, this is April. This is Autism Awareness Month. Let us be aware. Let us be a part of the cause and not the problem. Spreading and becoming aware of autism.